In the postvention process, schools have an important role in preventing suicide in two major ways. One, by specifically supporting youth and children who might be at risk from their own stress or who have experienced a loss to suicide. And two, by educating young people that suicide is preventable and by showing how communities can be healthy and supportive. Suicide by a member of a school can leave the entire school community struggling to cope. Schools need reliable information, useful tools, and practical guidance to build a plan and respond promptly and constructively. The American Foundation for Suicide Prevention and the Suicide Prevention Resource Center, two of the nation's leading suicide prevention organizations, have collaborated to produce resources to help schools determine a what, when, and how plan after a suicide occurs. In other words, a postvention plan. Please refer to the Schools chapter in the Postvention Guide for a link to After Suicide, a Toolkit for Schools. This is an excellent reference for schools that has many specific tools, such as a sample agenda for an all-staff meeting after a suicide death, sample death notification statements for students and letters to parents, and a sample media statement. It also gives brief tips on how to talk about suicide and address blaming and scapegoating. This can help prevent suicide contagion, the domino effect of suicides that occur after a first suicide. Sometimes suicide contagion can occur after a young person dies by other means, such as an accident. Although suicide contagion is comparatively rare nationally, adolescents appear to be more at risk after the loss of a peer to suicide than adults do. This might be because they identify more readily with the behavior and qualities of their friends and peers. Suicide contagion is a serious concern in Alaska. If there appears to be a risk for suicide contagion, school administrators should consider taking additional steps beyond the basic crisis response. This should include stepping up efforts to identify other students who could be at a heightened risk of suicide, collaborating with community partners in a coordinated suicide prevention effort, and possibly bringing in outside experts. The state of Maine makes this suggestion. A crisis can easily overwhelm school staff members who themselves may be directly impacted by a suicide. It might be a good idea for small rural schools to develop formal agreements with neighboring schools and/or districts to provide staff for mutual assistance during a crisis. Alaska schools are required to have a crisis response plan, which includes responding to a suicide. The American Foundation for Suicide Prevention and the Suicide Prevention Resource Center have provided some underlying principles for school-based postvention. Be consistent. Schools should treat all student deaths in the same way. Having one approach for a student who dies of cancer and another for a student who dies by suicide reinforces the stigma that surrounds suicide. It can also cause pain and confusion for the family of a student who has died by suicide. Be careful. Schools should also be aware that adolescents are vulnerable to suicide contagion. Responses to student suicides must not inadvertently glamorize or romanticize the student or their death. Educate. While the privacy of the student who died by suicide and their family should be respected, schools should include in their postvention efforts an educational component that teaches students about the role of depression and mental illness in suicide. This is important because no one will ever know all the reasons behind a suicide. It's important to keep a lid on rumors and not jump to conclusions. Incorporate training on safe talk or other suicide intervention models as a way of building student resilience against suicide contagion. Follow through. Ensure that students who might be at risk of depression or self-harm after the loss of a friend to suicide have access to support and treatment services. This is key to school-based postvention efforts. If those services are beyond the capacity or expertise of the school staff, it is important that the school bring in community behavioral health professionals and others to address the needs of the students. Teachers and school staff also have a role in community-wide postvention efforts. Coordinated crisis response with community partners such as mental health providers, spiritual leaders, and youth organizations allows schools to better support students and parents struggling with a loss to suicide. Schools can supplement postvention and crisis response from community service providers by providing safe and appropriate opportunities for students to express emotions and identify personal strategies for managing them. After a student's suicide, schools are often asked by family and friends to memorialize the person in a large event. It can be challenging for schools to find a comfortable balance between compassion for grieving students and preserving the school's primary purpose of education. In the case of suicide, schools must also consider how to appropriately memorialize the student who has died without risking suicide contagion among surviving students, some of whom might be at risk. This is why it is so important that schools strive to treat all deaths in the same way. Please refer to the Postvention Guide Schools chapter for some very valuable resource links and contact information for school administrators, teachers, and personnel. You'll also find a helpful questionnaire from the Maine Center for Disease Control and the Alaska Department of Health and Social Services that can serve as a tool for creating an effective postvention plan for dealing with a future crisis in your community.